So I'm from the University of Wollongong, and I'm going to be presenting our research exploring the general practice nurse's role in delivering primary mental health care. Other researchers was Professor Liz Halcombe, who is here at the moment, but I don't think she's in the room at the moment, and Chris Patterson and Lorna Moxham, who unfortunately can't be here today, but they do send their apologies. So we know that nurses in general practice are recognised as one of the fastest growing healthcare sectors in Australia, and they are ideally placed to, within community settings, to provide first line care. And while they routinely assess and manage people living with chronic health conditions, including cardiovascular disease, diabetes and asthma, the same level of assessment is not always applied to persons with chronic mental health conditions. This is despite the increasing presentation of persons with mental health issues to general practice and the potential for these nurses to enhance the recovery and well-being of these individuals. So given the growth of nurses working in general practice, it is timely to explore their role in delivering primary mental health care. So just as a bit of a background, population-based surveys conducted by the Australian Bureau of Statistics reveal that 7.3 million Australians have a mental illness. Now, with the total Australian population having risen from 20 million to 24 million since these surveys were conducted in 2007, it can be anticipated that the number of people living with a mental illness has also risen dramatically. Indeed, in 2014-15, there were 17.6 million mental health-related GP presentations, and of these, anxiety and depression were the most frequent mental health presentations. So as evidenced in this slide, there's a huge cost attributed to mental health services, and in addition to these costs, there are many hidden financial expenses associated with living with a mental illness which are not costed, and these include loss of potential income, medication and housing. So given the increased cost and burden of mental illness within our community, the importance of improving primary care services for people with mental illness is paramount. So we already know that a strong primary healthcare systems reduce healthcare costs, they have lower hospitalisation rates and deliver better health outcomes. However, only 1.2% of the 15,000 plus nurses working in general practice hold mental health credentialing. Therefore, it's very important that we understand the role of the delivery of mental health care by the largest group of nurses working in general practice. So the overarching aim of this project was to develop mental health practice standards for nurses in Australian general practice. But to achieve this, the research team needed to explore the role of general practice nurses in delivering primary mental health care, and that's what I'll be presenting here this morning. So firstly, we had to undertake a critical review of the international and national literature around the history and evolution of general practice nursing and the current issues and trends that impact on these nurses in relation to mental health. And findings from the review we used to develop an interview guide. We then conducted individual semi-structured interviews and focus groups with general practice nurses, credentialed and non-credentialed mental health nurses working in general practice, practice managers and GPs. And data from the interview and focus groups underwent an iterative process of analysis, and we used to create a draft document which was reviewed by the expert reference group and project steering committee for comment. So findings from the literature review, we found that much of the existing literature has focused on functional tasks carried out by nurses in general practice rather than the broad scope of practice, roles and competencies of these nurses. And a 2012 survey of general practice nurses reports that nearly 3/4 of these nurses never or infrequently provide mental health care. In addition to this, another study found that 94.2% of general practice nurse participants have patients ask them about aspects of depression. However, only 17.6% felt able to respond effectively to these individuals. The literature also shows that many nurses transition into general practice with a rich wealth of clinical experience. And despite this, APNA's most recent 2017 workforce survey reports that around half of the respondents indicated that they could take on more complex activities and extend their role within their scope of practice. Now, this evidences the potential for these nurses to do more within their scope of practice around mental health care. So the literature also reports that general practice nurses have the knowledge and ability to manage the delivery of interventions within their scope of practice, and that these interventions are acceptable and feasible to GPs and consumers. And indeed, interventions delivered by general practice nurses report greater consumer compliance and produce similar outcomes to GPs for a similar cost involving mental health conditions, but this was predicated on appropriate training being provided. And we also know that while general practice nurses are regularly caring for persons with mental health and illness, they do not always have the skills or confidence to deliver mental health care to these individuals. So the next phase of the project comprised of interviews with general practice nurses and the credentialed and non-credentialed mental health nurses and the practice managers and GPs. Now, these interviews and focus groups provided qualitative insight into the role of nurses working in general practice and the provision of mental health care. So the GPNs acknowledged that they saw people with mental health conditions all the time and had developed good relationships with these individuals. However, they used terms such as zilch, none, nil, not a great deal, and no experience in mental health to describe their experience in mental health, and acknowledge that primary mental health care was not always done well, which I think can be seen by the last quote, where they have a quick conversation in the corridor and a quick note in the case note, so they do acknowledge that it isn't always done well. Several articulated that they were not always comfortable talking with people in crisis, and that existing funding and lack of time were barriers to providing primary mental health care. This perception was reflected by practice managers who felt GPNs were already struggling to cope with tasks such as immunisations and chronic care plans, and managers were also concerned by the lack of item number for GPN mental health care and felt that newly appointed medical assistants could help alleviate demand. So throughout the interviews, GPNs consistently articulated a desire for mental health training and recognised that their own limitations in providing mental health care. As this GPN describes, I'm just a screening tool really. I guess I can do a little bit of motivational interviewing, but really that's the end of my skills really. My knowledge of medications is probably not that great, and certainly my knowledge of referral pathways is not that great. However, funding for training was generally not supported by the practice, and as another GPN stated, training was off my own bat. So another general practice nurse provided the following insight around the need for training to expand the GPN's role in primary mental health care. The GPN is sitting there. Give them the skills and they will be able to do heaps more in mental health. They're the ones seeing them all the time. Indeed, interviews with mental health nurses working in general practice suggest that these nurses are supportive of GPNs doing more and saw this as a way forward of meeting the increased demand in mental health presentations in general practice. And reflecting the GPN's desire for mental health training, mental health nurses would like to see GPNs trained in risk assessments and aggressive management. So a review of the literature and subsequent interviews has identified many of the barriers impacting the delivery of primary mental health care by nurses in general practice, and identified the desire for these nurses to do more. However, GPNs expressed a need for education and support focused on mental health so that they have the skills to screen and actively engage in the management of these conditions. So this is a copy of the mental health practice standards that arose from this research, and I do have a few copies here, and more copies are at the Australian College of Mental Health Nurses booth around the corner. So the mental health practice standards for nurses in Australian general practice have just been released. In fact, I think I saw Ros Rolleston posted it on, oh, there she is, Roz, put it up on Twitter last night. Thanks, Roz. So this document helps to define some of the ways in which nurses working in general practice can specifically contribute to the care of those with mental illness or mental health issues. And as such, this document can provide a self-assessment tool for performance or ongoing professional development and a starting point for discussions around role and training needs with GPs and an overview of the patient's role, of the potential role for a nurse in this setting. And just in conclusion, defining the way in which general practice nurses contribute to mental health care will facilitate the development of their role, and clarifying the scope of practice and empowering these nurses to seek education and training to extend their mental health activities has the potential to improve the quality of mental health care in the community and improve health outcomes for those with mental health conditions. So we also have at the table just at the back there, Sharon, if you could just show, we've also got hard copies of the survey. We did put out the survey around the practice standards. We would like to extend the survey length, and we've now got hard copies here. There's some on the table there, and there's more around at the Australian College of Mental Health Nurses booth. So please feel free to pick up a copy, and your participation will be greatly appreciated. So thank you very much for coming here, and thank you for having me speak.